I'm Cheryl Linden. I am a counselor and an OT at the Shepherd Center. I've been here for 32 years and primarily work with adolescents with spinal cord injury. I think a lot of it has to do with acceptance. You know, who's going to accept me as I am now, and how will I be with my friends? How's this going to work in terms of getting back in to my life? Because now I feel like I'm going to stick out.
Gotcha.
Yeah. It's common, particularly with major change in people's lives. I think the first and foremost thing is it's imperative that you make sure that person is safe. And if that means that you need to sit with them for a while and listen, not expecting somebody to counsel somebody through those thoughts, because you really need to have that kind of experience in order to do that. But, you know, a lot of times people are, just because it's a thought doesn't mean that they're actually going to do something. Or somebody may say, I don't want to live like this. And in further questioning in terms of counseling, you may find that they don't want to do anything to themselves, but they would rather not live like this. That doesn't necessarily mean they're going to harm themselves. But if you're with someone, if you're in a safe space, that seems to be more helpful. If you're out in public and somebody says that, then by all means you need to make sure that they are safe and that you are with them. For example, at Shepherd, if somebody's in a wheelchair and they're on an outing, particularly if it's a power wheelchair, you really need to keep tabs on them, because what if they do have intent to harm and they drive out into the street? And so that's the first and foremost thing. Sometimes it's very helpful to listen for a while and then to suggest to the patient, you know, I think that maybe we need to get you back with your counselor if they have one, or let's find someone for you to talk with. I think that they also need to let them know that I need to tell somebody. If you have a counselor, or if there's somebody in your family, I need to tell somebody that you're thinking this. And so being upfront and honest with them about what it is that you have to do. And you can say, it's my professional obligation, and you know, I care for you, and I want to make sure you're safe. And then in getting, let's say that they're, like again at the Shepherd Center on an outing, and coming back and making sure that you take them where they can be safe again, whether they're back in their room with nursing or something, and then immediately follow up with counseling. Because I think people, it's a scary thing. And again, because somebody talks about it doesn't necessarily mean they're going to do something, but we don't ever know in the moment. Is this something you're going to do, or are you just having these thoughts? And the counselor, the psychologist, whoever works with them at that point can then determine, you know, do we need to admit this person somewhere? Is it so severe that we really feel they're going to do something? And unless you have that background, it's hard to decipher out what it is. They can, a number of things. If there's family present and the person has a good relationship with family, then you can certainly notify the family and ask them to be with them so that they're safe. The family then can, take them into an emergent situation. If you need to, call 911. Let's say they're actively attempting to try something, then by all means what you have to do is you need to call 911 and get somebody there, so that you're not, left with, oh my gosh, I don't know what to do, and then something happens. Because it's, even those of us in counseling will often seek out either supervision or just a colleague saying, hey, this is what's going on. I'm just bouncing off you what I'm going to do about it, because that's a place where you just don't want to make a mistake. Have the suicide hotline, and if you don't mind, if I can pull it down here real quick. Okay. The National Suicide Hotline is 1-800-273-8255. Or you can also dial 1-800-SUICIDE, SUICIDE. And that's the National Suicide Hotline. That's 24 hours a day, and there will be someone there. So you can access them for help, and they can also assist in help. And then I have some resources that I can leave for people, in terms of what kinds of questions might I ask if somebody is talking with me about that. It's a scary thing, but it's you can work through that with someone. If you stay calm, that helps that person stay calm. If you get ramped up, that tends to ramp them up, and then that escalates the situation. Mm-hmm. So, you're a professional, and you've dealt with difficult situations before. And so just keep in mind, most of the time, keeping that person calm and keeping yourself calm helps the situation. It helps to de-escalate anything that may be going on.
Sounds good. Thanks, Cheryl.
You're welcome.